Hello, my name is Nicole Wall, licensed insurance broker and owner of Holten Financial and Insurance Agency. Presenting with me is licensed insurance broker Lucy Castoric. The Medicare Scholar Program is designed to give educational content about different Medicare topics each month. This month we are covering what you need to know about Medicare and hospital stays. This presentation will describe the two types of hospital stays that Medicare beneficiaries are most likely to experience, inpatient and outpatient, and what they should know about each. Some things to point out with inpatient: it starts when you're formally admitted to the hospital with a doctor's order, and the day before your discharge is your last inpatient day. For outpatient, if you're getting emergency department services, observation services, outpatient surgery, lab tests, or any other services, and the doctor hasn't written an order to admit, even if you spend the night in the hospital. Qualifications. In order for a beneficiary to be admitted to the hospital as an inpatient, a doctor either needs to officially order the inpatient stay, or the hospital's utilization review committee will make that determination. Some emergency room or urgent care visits can quickly turn into inpatient hospitalizations if the patient's condition is severe enough or the treatment for their illness or injury is complex. Coverage. Medicare Part A will cover a semi-private room, meals, general nursing, drugs as part of the inpatient treatment, and other hospital services and supplies. Medicare Part B may also pay for some care received from specific providers like specialists, surgeons, anesthesiologists, etc. Medicare does not cover private duty nursing, a private room, unless it's medically necessary, like in the instance of an infectious disease, television and phone in the room if there's a separate charge to use them, and personal care items like razors, slippers, socks. Inpatient costs. $1,408 is the Part A deductible. This is charged as soon as the beneficiary is formally admitted. Days 1 through 60 is a $0 coinsurance. Essentially, the Part A deductible covers the first 60 days of inpatient stays. Days 60 through 90, there is a $352 coinsurance per day, 25% of the Part A deductible. Days 91 and beyond is $704 coinsurance per day, which is 50% of the Part A deductible. These are called lifetime reserve days, and a beneficiary only has 60 of these available during their lifetime. Once the lifetime reserve days are used up, a client will only be covered up to 90 days for each benefit period. Beyond lifetime reserve days, a beneficiary is responsible for all costs. Some Part B covered services or items would be subject to the Part B deductible and 20% of the Medicare approved amount. Benefit period. A benefit period starts the first day the beneficiary is formally admitted as an inpatient and ends when they haven't received any inpatient hospital care or skilled care in a nursing facility for 60 days. For instance, a client was admitted to the hospital for 10 days, is discharged, but is back in the hospital 15 days later. Since they were not out of the hospital for 60 days when they were readmitted, they continue with their benefit period starting at day 11. They do not need to be readmitted for the same condition they were originally hospitalized with. I'm going to hand it over to Lucy to talk about outpatient qualifications.
Great. Thanks, Nicole. So qualifications. Medicare Part B covers medically necessary diagnostic and treatment services a beneficiary may receive as an outpatient from a Medicare participating hospital. Coverage. Emergency or observation services, same-day surgery, laboratory tests billed by the hospital, x-rays and other radiology services, medical supplies like splints and casts, preventative and screening services, and certain drugs and biologicals that you would not usually give yourself. Self-administered drugs. So Medicare does not cover prescription and over-the-counter drugs beneficiaries receive in an outpatient setting, sometimes called self-administered drugs. Many hospitals have policies that don't allow patients to bring prescription or other drugs from home and must be dispensed from the hospital's pharmacy. This is to ensure drug adherence while under the care of the hospital and to manage any adverse drug reactions. Outpatient costs. Part B deductible, if applicable, then 20% of the Medicare approved amount for doctor and other healthcare provider services and supplies. 3-day rule. So if a beneficiary requires rehabilitation that must be done in a skilled nursing facility after receiving care in the hospital, there's a specific trigger that must be met before Medicare will cover the costs of the skilled nursing facility stay. A beneficiary must have been admitted as an inpatient in a hospital. They had to have stayed at least 3 days, not including the date of the discharge as an inpatient, and then transferred to the skilled nursing facility within 30 days of discharge. For beneficiaries that are in the hospital as an outpatient, this may cause issues. Hospitals are required to give beneficiaries the Medicare outpatient observation notice after they are in the hospital for 24 hours, but have not been formally admitted as an inpatient. This notice includes information about their outpatient status and how it affects their ability to receive care in a skilled nursing facility should it be ordered by their physician. Note, some Medicare Advantage plans waive the 3-day inpatient requirement for skilled nursing facility services. Clients who receive the MOON should ask their providers if they're able to receive their rehabilitation at home instead of a skilled nursing facility. Okay, I think I'm going to turn this back over to Nicole now.
Thank you so much for watching. If you have any questions or comments, please feel free to contact us. Or if you would like to have a free Medicare Scholar presentation at either your local senior center, VFW, lodge, or other activity group, please let us know. We would love to set something up with you. There's a one-page summary about this topic in PDF format you can access by clicking on the link in the description below. Lastly, keep a lookout for our next presentation that will cover the topic of signing up for Medicare. Thank you so much.